BTEC Health and Social Care. Options Evening Information. This PowerPoint has been made to show you a little bit about what's included in the BTEC Health and Social Care Level 2 course. So, why study health and social care? Health and social care workers have been vital in the fight against COVID. Not only have health and social care workers such as doctors, nurses, healthcare assistants, care workers, social workers been on the front line, but there's also been those professions that have been supporting the NHS. We have had the police having to take over doing some 999 calls for the ambulance service. We've had the fire brigade driving for the paramedics. It's great to see how many professions have got involved to help fight this pandemic, and this is how important health and social care is in our community. Studying health and social care is great if you're considering some of the following professions. Lots of students who study health and social care are interested in doing jobs such as a midwife, a nurse, a healthcare assistant, an occupational therapist, a physiotherapist. I've got students that have now qualified at level 3 to be paramedics, students that are now working in hospitals as fully qualified nurses. We've had teachers, firefighters, police, dental nurses. So there are so many important job roles in health and social care that are vital, absolutely vital in our communities. So what personal skills will you need to take this subject? It's really, really important due to the sensitive nature of some of the topics we discuss that you're mature, that you're able to listen, that you're able to voice your opinion, but also to make sure that you can respect the opinions of others. People will have different opinions to you, and it's important you don't disregard those, but you also consider their opinions as well. It's important that you can be sensitive to others and that you will also work hard. So, what is a BTEC worth? A BTEC is worth 1 GCSE, and it is equivalent to 1 GCSE. The BTEC course includes 60% coursework and 40% exams. This is a great course if you prefer to do handwritten work or typed up work rather than the pressure of an exam. Grading. You'll be assessed totally different to GCSE lessons. GCSE lessons are graded 1 to 9. However, with this qualification, as in all BTECs or Cambridge Technicals, you'll be graded either a distinction star, which is equivalent to a 9, a distinction, which is equivalent to an 8, a merit equivalent to a level 6, and a pass equivalent to level 4. If you do not make the level 2 criteria, you will then be given a level 1 grade, which is equivalent to levels 1 to 3. So the course will be split into 3 components. Component 1 and 2 are coursework, and they'll be done in year 10 and completed in year 10. Those grades that you achieve in year 10 can't be changed in year 11. So they will be your final grades in your coursework. You will have them in the bag, and then on component 3 in year 11, you will sit the exam. The exam is sat in January, and the results come out in March. If you are not happy with your grade, you are allowed to retake the exam. So that's very different to GCSEs. You are given an extra opportunity to improve on your exam result. So the order in which they'll be taught. So I'm actually going to do it in numerical order. I'm going to teach component 1, which is human lifespan development, which I'll go into in more depth on another slide. Then component 2, health and social care services and values. Then component 3, which is the exam. Now, like I said, if you do really well in your January exam, we get the results in March, and you've got, so for example, a distinction or a merit, and you don't want to retake because actually that's pretty good for you, then you have finished the course. So you will have a whole GCSE grade in your bag by March time. So that's one pressure off you, so you can concentrate on your other GCSEs. So, as I stated, the coursework, there are 2 units or 2 components. It will make up 60% of the qualification, so it's a huge percentage. So not everything relies on an exam. Both coursework units will be taught in year 10. All coursework will be marked by your teacher, and then moderated by an examiner. So I will mark your work, give you a grade, and then the examiner or the moderator will have a look and see whether they agree with me or not. We have not ever had it where the grades have needed to change, which is great. You will get taught the content for each unit, and then you'll be given an assignment brief or coursework guide on how to complete your coursework. Your coursework will then be graded. You will have the opportunity to improve your coursework once after a first submission. So you complete your coursework, hand it in. If I believe that you could do better and you reach the certain criteria to have a retake, you will be allowed another opportunity to improve on your coursework. So like the exam, there is another opportunity to improve. So here's a little bit of information about what each component involves. So component 1 is human lifespan development. So you'll look at how a human develops, so how are they conceived. You're looking at an infant from all the way from 0, so birth to death. So how we develop over each of those different life stages. What happens to our body? What happens to our intelligence? What happens to our emotions? How we socialize differently throughout those different life stages. It's a really, really great unit to get your teeth into, to understand what causes us to change and how we adapt our life with those changes. You will look at how we learn during childhood, so how we develop language, how we learn to play. So we start off very much looking at how children play by themselves, how they gradually learn to sit side by side, and how sharing can take a bit longer. You will look at social and economic factors that affect life. You will look at expected and unexpected life events. So an unexpected life event could be that you have a serious accident and how they could impact our lives and how we could cope with it. You will look at different sources of support, so formal support such as a nurse, doctor, midwife, and their role in helping somebody to get better. But you could also look at informal support, the support that's there when the formal support is no longer around, such as family and friends. So you'll have a look at how these type of people can support individuals who've had an accident or a divorce or grieving from losing someone. So component 2 is health and social care services and values. This is a great unit to get an understanding of all the different job roles in health and social care. It looks at health and social care professionals from different settings like hospitals and social care. It talks about a lot about understanding the roles of different professionals, what they actually have to do daily, how health and social care professionals should care for individuals, so looking at the values that they should be delivering in their care, making sure they're respectful, maintaining dignity, ensuring that they have maintain confidentiality. And you learn about the range of health and social care services, so primary, secondary, tertiary, and barriers that individuals face when accessing them and how they can be overcome. You will learn to adopt caring behaviours and practice demonstrating care values, and you will learn how to review your own practice. The best thing about this unit is that 2 of the grading criteria can be done by completing a role play. So this unit's not all about writing. You will get the opportunity to undertake a one-to-one and a group role play that you will then have a look at and see what you could do to improve in the future, what you did well, etc. So the exam is 2 hours long. Now this sounds really long, but when you look at it, most exams are 1.5 hours or to 2, and sometimes some subjects have 2 or 3 papers. So 1 2-hour long exam is not that bad. The exam is on health and well-being. You will be expected to answer questions on poor health, so different types of poor health. You'll be expected to look at how different lifestyle factors can affect health, such as smoking, drinking, drugs, lack of exercise, and a poor diet. You'll be expected to interpret lifestyle data, such as blood pressure, peak flow, BMI, and pulse rate. You will have to design a health and well-being plan, and you should know what can prevent people from improving their health. The exam is taken in Year 11 in January or early February, and there is an opportunity to retake in the summer if you want to improve your grade. So just a little bit more information about assessment. Every single topic that we discuss in health and social care is linked to a real life job situation. This is a vocational qualification, which means it prepares people for working in health and social care professions. It's a great qualification where it's directed at how you would put yourself in the shoe of a nurse, doctor, firefighter, police, social worker. And it's actually there to prepare you for real life work situations. Your work will be marked by your teacher at the end of each learning aim, and as I've discussed, if you fulfil the criteria to improve your work, you'll be given it back and the opportunity to do that. You will get 15 working days to do that. So that in itself is brilliant, because say for example you narrowly missed out on a distinction grade, it could have just been a paragraph that you missed. You have that opportunity then to go back, make those amendments and try to secure the higher grade. So what makes you a pass, a merit or a distinction student? Most pass tasks that you'll be asked to complete will involve you describing, identifying or listing what you're talking about. So it could be to describe primary healthcare. That's the standard that they'd expect you to do there. Merit tasks will ask you to explain how it works and to give examples. And for a distinction task, you'll be asked to either justify or evaluate. So why has something happened and the reasons behind it? So the more in depth your work goes and the more you're able to explain why things happen, the higher grade you'll be able to get for your coursework and for your exam. So what's it all about? It's about covering topics that will prepare you for working within a health and social care environment. That is a difference between a BTEC and a GCSE. A GCSE covers subject knowledge, whereas a health and social care does do that, but it also links to real jobs, so that you can go on to study health and social care at level 3 or nursing at level 3. And you can actually take that on and be more prepared to work in that environment. So the type of jobs that are included in this environment, the ones that we discuss mainly, are childcare, nursing, social working, counsellor, midwifery, support workers, hospital play worker, medical technician, dental nurse, firefighter, police, teacher, working with the elderly, disabled, and a nursery assistant. And these are a few. There are many more jobs that are entailed. I have lots of students that have gone on to nursing, midwifery, dental nurses, occupational therapists, physiotherapy, teaching, firefighters, police. There are so many different jobs. Working in a care home, working in nurseries. There are so many jobs that this qualification can lead you to. So, do you need to know more? If you do, and if we're in lockdown, please email Mrs. Vickers or Mr. Clark, and we'll be very willing to answer any questions that you have. We are here to help. We are here to guide you. We're here to help you select the right options for yourself. So please do not hesitate to contact us. Thanks for listening.